Today, we're going to be talking about using simulation in healthcare. We'll try to make this a teacher-to-teacher session. And joining me, we have Darlene Clark. She's a healthcare science educator and medical professional with over 34 years of experience in the healthcare industry as an occupational therapist and 21 years teaching in secondary education. Currently, she's a health occupation instructor and HOSA advisor at New Britain High School. Today, she will tell us about her experience with Body Interact so far and the impact it has on her teaching and the learning process of the students. So here's the agenda for today. I'll start first with why virtual simulation and the impact on critical thinking. Then I'll show you what we've been working on the last few months on Body Interact and our updated features. And then we will hear from Darlene Clark's experience. So why virtual patients? Body Interact represents a new teaching methodology that is based on virtual patient simulation. We help educators move from traditional classroom where students learn in a primarily passive way to a more experimental approach, where we challenge students to step into the shoes of real healthcare workers and go through lifelike scenarios in a controlled environment without harming any patients. Our main goal is for students to be able to develop strong critical thinking and problem-solving skills and start building their foundations of clinical reasoning. This critical mindset that they will need when they have a real patient in front of them. And simulation has proven to be one of the most effective ways to learn it. It puts the students in the moment, engage them in parallel ways, and we have to take into account that since they are digital natives and very exposed to gamified environments, this type of learning method, it's really attractive to high schoolers. As you all are quite aware of, Gen Z students have grown in this digital era where technology is deeply integrated into their lives. They cannot live without it. The Body Interact approach can help you adapt your teaching approaches to meet the specific needs and learning styles of these specific generation students. It provides a really interactive and technology-driven learning experience that resonates with their preferences. These students also thrive in collaborative environments and appreciate the instant feedback. This technology allows them to work together in teams, simulating interdisciplinary collaboration and receiving immediate feedback on their decisions and actions. The engaging design and realistic settings and interactive feeling of Body Interact really captivates them. We focus mainly on developing important cognitive and soft skills. You can also develop hard skills with Body Interact, but our main focus are soft skills. Collaboration and critical thinking are not just desirable skills, they are fundamental to succeed in any healthcare profession. Body Interact can help you create an ideal environment to promote teamwork and collaboration among your students. And by engaging them in simulations, students can work together, analyze diverse patients, discuss treatment options, and make decisions as a team. This process not only strengthens their critical thinking abilities, but also prepares them for the collaborative nature of healthcare practice. And we see this happening really in real life at the HOSA's competitions. We see how students can tackle a bit more challenging cases that demand more information gathering, more data analysis, and collective decision making when they work together as a team. Where can you use Body Interact? Body Interact can be used in the classroom, teacher-led sessions, a student-led session, teamwork. Can be used also in the simulation center, including being used combined with the simulation resources that you already have. It can be used remotely. You can assign cases for your students to solve with homework. You can have synchronously or asynchronously sessions with them. And these can also be used in a flipped classroom manner. To help you explore the true versatility of body interact and the wide range of teaching approaches that it supports, we have updated our instructor guide. And inside, you will find multiple examples with step-by-step explanations of different methods and ways to integrate body interact in your teaching and in your curriculum. Additionally, the guide includes a complete list of resources that we have available on our website and YouTube channel, such as blog articles, testimonials like we're going to hear tonight, and playlists and much more. This document is available to all of our customers. You can download it directly from our website, or you can reach out to us to have access. As I said at the beginning of this webinar, one of the topics for today is to show you the major features that were recently implemented. So we updated our dialogue structure. Before, it was not so intuitive to figure it out where the questions that we wanted to ask were. And with this new structure, we enhanced the clinical reasoning and the communication skills because it's very intuitive and evidence-based. Also, we updated the physical examination. So before, it doesn't matter which scenario you're solving or in what environment, the physical exam that was available was in a ABCD approach. Of course, that's something that we needed to improve due to the fact that the ABCD approach is more for emergency situations. So in our consultation environment at this moment, you can perform a complete head-to-toe physical examination. We also added the learning goals at the beginning of each scenario for a clear direction and focus. So these learning goals will not disclaim anything about the scenario or the diagnosis or what the student should do. It's just a guidance for them to know what the objectives will be. We also started implementing or integrating AI in our platform. So at this moment, we have an AI assistant called Sophia, and she's a tool to help students clarify concepts and organize their thinking before starting the simulation. So this AI assistant is available during the briefing part of the scenario. You will not provide any information about the patient or diagnosis or treatment. It will only help the students to clarify some terminology that it's in the briefing and they don't know, or just to make sure that the approach they are thinking to use on the patient is the correct one. At the end of the scenario, you will be able to find a new optional question, which is the end of. At the end of the scenario, students can practice communication and data sharing using SBAR, SOAP, and train how to end off a patient. If they are not at this level and they don't need to train this skill, since it's an open text box, they can at least type down everything that they did and the priorities they found throughout the scenario, just to organize their thoughts. To make navigation faster and less frustrating for the user, we also included now in all menus a search option. Before it was Clever single sign-on available. Now you can sign on with Google and also with Office 365. For the feedback, so the former structure was focused on physical examination, diagnostic activity, and treatment. We have updated this to a new structure in alignment with current best practice guidelines in clinical education. The new structure is composed of the following areas, as you can see in these images. Communication, which includes the dialogues. Assessment, including tests and physical examination. And management, including interventions, calls, and medications. Updating also the structure. We, of course, receive feedback from the end users. And something that was missing on our feedback was a more comprehensive side. What I want to say with this is that sometimes if the student is solving a scenario on their own, was not comprehensive enough for them, what they did wrong and why, or what they were missing. So this AI integration also in the feedback, with this integration, we are trying to provide a more comprehensive report of each simulation conducted by the users so they can better reflect on their individual performance. And as you can see, we highlight the areas where they performed really well and the areas where they can improve. As I'm sure all of you experienced, there are some grayed out items throughout the scenarios. And we found out that this was really an issue while solving the case. Why is that item that I need to use grayed out? So now we have an explanation for each time that happens. And it could be something very simple, like you want to start an IV fluids and you don't have an IV placed before. Could be something like that, but there's also always an explanation. Taking into consideration ethics and the privacy of the patient. Now we also have the option available when you're performing physical examination and you need to remove the clothes of the patient to put it back after you finish. And to let you know what's coming soon, we will continue to improve our 3D avatars and medical objects for a more realistic simulation experience. We've been working on this and we hope to do it even better in the future. We are also working on a more comprehensive simulation reports in the BI Studio. We want to be able to give more information to the teachers and more information to the students, and in an easier way to understand and to use. There will be a new dedicated area for the professor in the BI Studio, full of interesting pedagogical resources, from information on how body interact can be combined with different methodologies, student tips, webinars, recording, all resources that you can find useful. There's a couple of photos here explaining what you'll be able to find there. And then our major goal for next year is the AI-powered patient dialogues. We want to be able to enable students to engage in natural conversations and ask their own questions to the virtual patients. And as you can see in this prototype that I'm going to show you right now, you can either speak or type questions to your virtual patients and get immediate responses from the patient. But it's something that we are still working, and it's our major goal for next year. How can you stay up to date with these new features that we will launch? Every month, we send out a newsletter to all customers. In it, you'll be able to find the latest features, updates, and improvements as soon as they are released. So keep an eye on your inbox and don't miss these updates. These are enhancements that we've been working on that we truly hope they bring value to our customers by making the teaching and learning process more effective and engaging. Now, let's hear from Darlene, who will share her experience and explain how Body Interact has impacted her teaching and our students' outcomes. Darlene, the floor is yours. Let me just say something before giving you the word. At the end, we're going to have a Q&A session, so please feel free to leave your questions at the chat or the Q&A item that you have on Zoom. Sorry, Darlene, go ahead.
That's okay. Thank you so much, Maria. I look forward to those updates. They sound amazing, really. Okay, I'm going to share my screen now. Just give me a moment. Just one moment.
Mm-hmm.
Okay, am I good? Okay.
Yes.
All right. Hello, everyone. My name is Darlene Clark, and I'm happy to be here this evening. It's evening here for 18. I'm coming to you from New Britain High School, where I am a healthcare science teacher, health science teacher. I have been here at New Britain High School. This is going on my 23rd year, actually. And I'm here to talk about how Body Interact is used at New Britain High School with our students. Okay, so we are a comprehensive high school. I'm sorry, my screen is on the other side. Comprehensive high school. And we have over 400 students in our health academy, and we have biomedical science, healthcare science, and our nursing assistant course. And so a lot of our students have been in the health academy from 9th grade to 12th grade, and we share students. And so, you know, I have students in several classes of mine, and then I also have students who are in the other track, the biomedical track, and students who are in CNA. So our students are fluid through our academy. And we all 4 teachers, we use Body Interact in our curriculum. We discovered Body Interact through, well, I was watching a video of HOSA. I am a HOSA instructor, and we did not go to conference last year, but we, you know, I saw the video of students using Body Interact a couple of years ago, and I was very intrigued. And so we did some research, and our administration, you know, said, let's do it, let's try it. And so we purchased Body Interact, and we were able to implement it right away as soon as we got it. And it was kind of like mid-year. And so we were all new to it. And so we had to learn first, and we uploaded our students, and we got started right away. Our health academy, we were always looking for ways to realistically engage our students in, you know, real life situations. Quite a few of us do. We do simulations. I have always done simulations with my students in my lab, where students would, you know, create simulations and then perform them, and I'd videotape them. And so it was always something that was, you know, something that we tried to keep the students, you know, actively engaged and learning at the same time, because we want them prepared. If they're going out into the working world and they're working, you know, hands-on with patients, we want them to have that foundation of being comfortable and being able to critically think and and, you know, have that hands-on patient care. And so, and technology is also an important part of it. So when we learned of Body Interact and we implemented it, you know, we really thought this could be something that could be very useful for our students. We currently use Body Interact, like I said, as an academy. It's our 2nd year. And so we basically have the students use their Chromebook devices because they all have them. And we do have, like you see in the picture, we do have the big table, but it's, you know, the stand up. We have 2 of those, and I've used them for teaching purposes, you know, to kind of go through a simulation, or to have a student work with me to go through a simulation. And then sometimes I'll have 2 students or 3 students work together, and they really enjoy it because, you know, it's so big, and it's a touch screen, and they're able to use it. But for the most part, students are on their Chromebooks, either independently or together, depending on the situation. And we have the students run through scenarios in the beginning just to practice. And then we assess them. We did it quarterly, and we will continue this year. We will assess them to see how they actively engage with Body Interact, and we use a CER form, Claim Evidence and Reasoning. And we want the students to be able to, you know, adequately and proficiently, you know, make a claim, and then, you know, find evidence that supports that claim, and then, you know, tie it all in with reasoning and we want them to do it and, progressively get better, over the course of the year. So we use the CER form and we calibrate after we give the first CER using Body Interact. We come together as an academy, as a group, and we just calibrate to make sure that we're all, looking at their forms and assessing them or grading them, accurately and fairly. And so what we do with the data, the data is gathered, and then we, as a team, we look at the data to see how we can improve on teaching and learning as far as the students' ability to, make a significant claim and come up with evidence that is appropriate for the scenario, and then tie it all together. And so, in the beginning, I have ninth graders, and so they know nothing about Body Interact, or, many of them don't even know medical terminology. And so they're green with it, but they do learn. Over time, they learn, how to access, the different parts of Body Interact, and how to, take the information and, eventually their CER forms, claim evidence and reasoning, they get better and better as we go along. And so many of our students who are upperclassmen have done it. They've done it the year before, last year. And so we're going into the second year of using it, and we expect their claim evidence and reasoning to be, much better than previous year. Why we use BI as a valuable teaching tool? Body Interact is interactive, and it provides an immersive environment for our students. We have students who will be going out to do clinicals in the nursing home. And, having this experience prior to doing that is valuable. It's invaluable. Even though, it's technology, and it's not like, it's a real person, doing the assessments of the patient, and, having the experience with, trying to figure out, what testing to choose to help the patient, and, what other interventions they could use. It is definitely something that gets them thinking, and, gives them confidence to get out there and to, work with real people in real life setting. And many of our students have reported that, they feel comfortable with asking questions, because, it's something that, you're using with Body Interact. And our hope is that, again, it bridges the gap between, theory and practice. I'd like to show a video of our students who actively work using Body Interact. Maria, if you would. I'm going to stop sharing.
Sure. There we go. Please let me know if you can hear.
Oh, his glucose is high, guys. Or no, it's about normal. 6.9 is like around normal. So he's all right.
Oh, we don't see the video though.
Well, it's not diabetes. It hurts quite a lot.
Oh no.
No video.
Oh, I'm sorry.
That's okay.
I'm so sorry. How about now?
Let's see.
Can you see the video?
Not yet. Okay, here we go. Yeah. There you
Perfect. All right. So I'll play it again.
Thank you.
Oh, his glucose is high, guys. Or no, it's about normal. 6.9 is like around normal. So he's all right. It's a little high, but he's good. So it's not diabetes. It hurts quite a lot. He's talking. Oh, what is he yapping about? Put the volume on. Is 92 or 55. He said, ah. Is that what? Can you hear it? Yes. Let's do physical exam. Disability. Is he like special maybe? No, like I'm not even joking. Like maybe like something happens. People like why is it not working? Let's check his people.
Your computer's a little slow.
Is that good or bad? Lord have mercy. He's not. He looks like he's in pain, so maybe it's not. He's in pain. He's done. All right, let's try something else because he just keeps doing this.
How do I go back?
What do you want to do?
You already did the breathing.
Oh, abdominal. Okay. Pain. No rigidity, no pain, no guarding or signs of
So it's like mostly near the rib area. Pain.
So
See, it's like near the
his
rib.
upper ab, like upper here. What about down here?
No pain. So it's like on the upper part.
Can I do like?
He's on the floor. He's sweating too, right? Oh, there you go. I found it.
You put them all on at the same time.
Yeah, well, we got everything now.
Yeah, but we can't see that one. What is it?
I don't know. Okay, wait. Let me do one at a time. Okay. We need his heart rate. Okay. Respiratory rate. Temperature.
Okay, but how do we know? Okay, temperature's fine. How do you do this?
Okay, thank you. So that was a practice session. The students were, they were practicing, getting used to it. They had their CER form, they were working together. And so that particular group was, getting used to using Body Interact, and the goal is to, have them, well, the next session was a individual session where the students were, really doing it on their own. And that was the one that, I would take and kind of grade and to see how well they did. So the practice session, they were working together. They were able to share the answers because they were working together. So, we do it both ways. The 4 times a year would be the assessment, and then in between would be the practice sessions. Okay, so students are progressing toward, stronger reasoning skills, and we do see that as we, go through the school year. The goal is for increased confidence, of course, and to prepare for interactions that will help better prepare them for the future. The students really do appreciate the realistic scenarios, and it looks like with the improvements, they're going to get even better. So we're really excited for that. I can't wait to do my first one for the year. We're uploading our names now so that we can get started right away. So we're excited for that. And then for advice for fellow educators, we've had highs and lows, but we say to embrace, innovative teaching resources to engage your learners. Start small by integrating Body Interact with specific lessons. What the goal is to do it based on specific curriculum. But I'm going to do it with specific lessons that go with the body system. So I teach anatomy and physiology. So when I'm doing the skeletal system, I'm going to try to do a Body Interact scenario that has to do with bones, because I think it will definitely, last year we just kind of, not randomly, but we picked ones that we thought the students would enjoy and that they would be able to, do successfully. So this year we're going to hone in and try to be more specific. And then work closely with your tech department. We had some issues with technology. And I think ironing that out in the beginning will definitely bring more success and less frustration. Things eventually worked out, but it's best to just get that going in the beginning, and that way you'll have more successful scenario time. And then encourage students to reflect on decisions and outcomes. And then use data and feedback to continually refine instruction. And I think when we get together in our data teams and we talk about it, it definitely helps you look at things differently, you know, the next time you do body interact. Another thing I didn't add on is to, you know, use it, but don't overuse it. We want students to be excited about using it. And I think, you know, spacing it out and having it, you know, almost like, you know, as something to look forward to is definitely much better than maybe like using it every week. So like I said, we had some challenges with connectivity issues, but, you know, every time we reached out, we were just given so much support, and like the support was endless. I mean, I'd have emails come to me, and, you know, just asking, is everything okay? Is there anything that we can do for you? Initially, the training and onboarding was amazing. You know, from the beginning, we had no issues getting all the students onboarded. And I think the partnership has been really one that we've been very happy with. And we hope that, you know, it just gets better and better. So I have nothing but good things to say. Again, with any, you know, with anything, there's always going to be ups and downs and, you know, things that you have to work on. But overall, it's just been great. So I'm very happy. So that's about it, I think.
Thank you so much, Darlene.
You're welcome.
Great presentation, and it was very interesting to see that video of your students and see how they were struggling with understanding what's going on with the patient, but at the same time searching and making sure that they were debating with each other and finding the best solution for the patient. That was really interesting.
Thank you.
I remind everyone that is watching us that there's a Q&A box in the Zoom. So if you have any questions for Darlene, just please leave it there. And we already have some questions, and one is related to what you just mentioned, the TAC issues. There's a Shannon asking what were some of the TAC issues that you encountered, and you kind of replied to this, but please.
Okay, well, some of the things that in the beginning, it was connectivity. Many times we'd have Body Interact crash, and, you know, not on every device. It would be, you know, a couple of devices here, a couple of devices there. And we found in the beginning, they had no clue. They couldn't figure out what it was. But so we got, you know, it was the internal technology department here at the high school. They, you know, tried to see what it was, and then we had to go to the central office and so it was something internal on our end in the beginning, and then the student devices were updated. So that was, you know, another thing that they looked at. And then, you know, there was a port in the classroom that needed to be updated. So there were a lot of little things, and we wouldn't have known that unless, you know, we had all students on their devices at the same time. So that was one thing. That was the major thing, the technology issues with the devices crashing. And then we had an issue with every time a student opened up a result, like an MRI or an X-ray, it would freeze. And so we reached out to you guys, and you know, we kind of worked on that together. And it wasn't all the time, it was just a few times that it happened, but it was multiple devices. And so again, that was taken care of. So it was more, you know, crashing and then freezing and things like that, but we worked through it. So we worked through it.
There, you know, there are some of our customers who find these issues. There are others who run smoothly, but we have a team prepared to act as soon as we receive any indication of issues. And it could be on our side, could be internally, as we've had some teachers were not able to download the app, but it was because it was blocked by the IT department of the school. But usually we fix it pretty fast and with no issues. And I believe now, Darlene, you're using smoothly.
Yes, we are.
Perfect. There's another question. How easy was it to implement, and how well did the students receive it?
Very easy to implement. Once all of the students are uploaded on a spreadsheet, their names are immediately found, and you just make groups. And once you make your groups, you assign the scenario to the student. It pushes pushes it out to their computer, and they just hit the start button, and then you just let them run with it. Initially we didn't give the students any direction. We let them just go, and that seemed like the best way to do it. They had the most fun, and it went over well with them. You know, they're used to being online on their phones, video games. So this was something that was exciting for them, and it really activated, you know, a lot of prior knowledge that they may have had, or for some students, you know, with terminology, with, you know, the body systems. And then with students who have never had any prior experience or prior knowledge, for them, you know, they were able to, you know, work with other students, or, you know, learn more, you know, of what they didn't know by just doing investigations. And they, you know, maybe take their phone out and use their phone to kind of look, you know, for something that, you know, would help them during the simulation.
Thank you. There's another one which has to do with the 1 year that you already used body interact with your students, if you have been able to see improvements in their clinical reasoning.
Yes, from the beginning of the school year until the end of, or no, I'm sorry, from the beginning of starting the body interact until the end of the school year, we did see a significant improvement in, you know, their claim evidence and reasoning overall. And that was something that we were, you know, excited about, because it is a good indicator that students are, you know, able to use those critical thinking skills to, you know, to learn. And it's just one piece of what we do. So, you know, using that with the other ways that we're all teaching has definitely helped improve in that way. We all teach different things, but we all teach, you know, about the body in some way. And so, you know, we're able to bounce off each other, and we're able to take that data and look at the academy as a whole. So yes, we definitely have seen improvement.
And the last one that I can see here, if there's anyone else with questions, please leave it on the Q&A box. But we have this one, which is if you can use the clinical scenarios and adapt for the different levels of students that you have within the classroom.
So for myself, when I'm working, when I have students working with different levels in the classroom, more than likely I'm going to have students work together. And so I have my students in groups as you know already. So every day they come into the classroom, they are already in groups, and they're paired in, or they're in groups of 4. And so the students that I identify that would need, you know, extra help in any way, I'm going to pair them with a student who I know can help them. And then I give them, you know, the extra instruction or the extra encouragement to work with that student and try to figure out, how to navigate with Body Interact. It's only been 2 years, so we're still figuring out, how to use it and how to, with the improvements, it's just going to make it that much easier to help those students who may have difficulty with, learning how to navigate. So it's still is actively in progress. So what I typically do though is, like I said, I pair students up and I have them work together. And, I'm going circulating around to those groups just to see what the students' needs are.
Excellent. Thank you, Darlene. I don't see any more questions. I see a raised hand from Gary Kramer. I think if you could, I cannot give you permission on this format to speak, I believe, but if you could leave it on the chat, the question that you have, we would appreciate it. Or it could be just a mistake, hands up. And but while we wait to see if Gary wants to write anything, I want to show you and to make it available for all of you watching us. We're going to have next webinar next month, October 14th, at 4 p.m. East. And this scenario will be about the new launched anatomy and physiology scenarios that we have on Body Interact. And I'm also going to share that with you, Darlene. I don't think I have before, but we have these new scenarios where we continue to focus on the core of Body Interact, the clinical reasoning, but there's some anatomy and physiology features throughout the scenario that will help focus on those, on that knowledge. So if you want to attend, this is available on our website. I also left a link in the chat for you to reach out to us, and we are going to send invitations just like we did with this one. I believe Gary was okay with asking no question. I think it was clear for everyone. I thank you all for joining us, and I hope this has been valuable for you. And I thank Darlene for the excellent presentation and testimonial. For the ones who couldn't attend, we will send the recording. Thank you so much.
Thank you. Thank you.